18-year-old suffering from Down syndrome is referred to gynec clinic with an abdominal mass that needs exploratory laparotomy. She's an orphan, leaves residential home, accompanied to the clinic by one of the home's healthcare assistant. She has low IQ. Okay, let me look at the answers. Everybody has written as G, obtain legal advice on interpretation on Mental Capacity Act. Okay, so if emergency, what do you do? If elective, what do you do? Okay, fine. Definitely your answer is correct. But for example, the same lady comes to you with a twisted ovarian cyst. Okay, twisted orientation, ovarian torsion. Let me say ovarian torsion, hemodynamically unstable. What would you do? What would you do? She has, you know, that low IQ and you are the registrar on the duty. What would you do? Okay, proceed in the best interest. But just for your practical knowledge, remember you are going to take the two consultants' opinion. Okay, so emergencies always proceed in the best interest with the consultant opinion. Elective, always take the court order. Okay, fantastic. You're all well prepared, guys. Yeah. This is a very common thing, right? We always keep medical students with us. So what to be done then? Q. Okay. Yes. But you are supposed to be taking a verbal consent. Even for example, they have to look into you are doing a surgery. Somebody has to be there. Okay. Especially during when they're in anesthesia, it has to be very, very careful. They would say even during anesthesia, if you're allowing them to keep up a rectal suppository, they have to know what you are going to do. Okay. These things, they play around a lot. So understand the concepts, guys. I think you're all well aware of this. I'm happy about it. Next question. Let me see if any queries. Q and R. Okay, I'll answer you that, dear. Shahzadi, I've seen your thing. Don't worry, Aishwarya, I'll show you. Have patience. Okay. Okay, what is happening here? 39-year-old para 4 day case surgical unit for surgical termination and incision of Mirena, which she has consented for a week before outpatient clinic. She now appears somewhat upset and reluctant about undergoing this procedure. You all have written O except Sushma. Fantastic, Sushma. B. O, respect the rights of women to withhold the consent for the patient treatment. I'll tell you the difference. Okay. First, let me answer for the previous question which they had asked about verbal consent with witness and case note documentation. With witness is the difference between Q and R. Okay. You don't need a witness to sign this consent because this is a simple one and it's a verbal consent. Okay. Case note documentation, anyways, you would be doing. But here the thing is, and you won't, case note documentation, what they mean is you are not going to document that, okay, you're being observed by a medical student. Is that clear, Shahzad? Okay. You can type S if that's clear. And here, all of you have written O. What is the difference between O and B? Okay. Respect the rights of the women to withhold consent for treatment. True. What you are thinking is true. Defer the operative procedure. Here, the main thing is, you might be thinking defer the operative procedure is, I don't want to go about whether it is termination of pregnancy or the Mirena. Okay, the whole of the operative procedure you are deferring. Please understand there is a very important concept. If you have seen consent form in UK, it is two. One which you take in consent clinic on the 1 week or 2 weeks or 6 weeks before the procedure, you take a consent. Okay, and the same copy you would be giving. You sign, the patient sign, and the same copy they take home. On the day of the procedure, they are going to come back and you are going to take the reconfirmation of the consent. Whenever whenever a patient is reluctant, you defer the operative procedure. You are not going to do on that day. So your thing, respect the rights of the woman to withhold consent. You are only respecting the rights, but you are not taking any action. You say, okay, I'll respect your wishes. What next? You have to defer the operative procedure. All right? That's the reason B is a more appropriate and a complete answer rather than O. Okay? And difference between A and B. Am I clear about B and O first? Okay. I was very surprised, people, you didn't read the B. Everybody. One said O, everybody said O. Always think the person who has put answer before you is always wrong. Always. Okay. So you should always think you are the only one who is correct. Okay. Then only you will go well. Abandon the procedure and reschedule. Defer the operative procedure. Abandon the operative procedure is fine. But reschedule, are you sure that the patient is going to take again? That is the reason, that is the difference between A and B. Is that clear, Aishwarya? Okay, yes. And I think this is what you guys were all asking about. Okay, so less than 13. Okay, they cannot leave consent for any medical procedures, contraception, termination of pregnancy. Less than 13 years, this is definitely considered as rape even with consensual sex. Okay. Gania, O comes before B. Just a minute, guys. I think she's still stuck there. Okay. O comes before B, dear. But the point is, you are supposed to be giving the final answer, right? I am asking you, I don't want procedure. You don't say, okay, I'll respect your wishes. What next? Deferring the operative procedure means you are going to inform the stakeholders from your anesthetist to everybody. That is a definitive action. This is the principle. You are respecting our autonomy, but that is not the action which you need to take. Hope that's clear. Is that clear, Gania? Okay, thank you. Okay, coming back to this, guys, less than 13 years cannot legally give consent for anything, and less than 13 years consensual sex is rape. Actually, 13 to, you can say it is 16, it is not 15, 13 to 16, okay? So 13 to 16 years, they can give consent for contraception. They can accept every other procedure, but they cannot refuse. Okay. So basically 13 to 16 is meant for anything related with pregnancy, because you are allowing them to have sex after 13 and more. So you are supposed to be giving them consent for the same. Okay. And obviously 16 to 17, the best thing is they can accept everything, but they cannot refuse anything. And 18 and more is considered as adult. Okay, so they can sign everything. Somebody is still worried about 12. Guys, what is your problem? What is the confusion here? It's a very simple one, right, Neha? What is the confusion here? You have been, for example, you are a consultant and the medical student asks you, can I be there when you do a POPQ? So you will tell the patient that my student is going to be there with you so that it would help you to do better or understand better. Prabhati, is that clear? Sorry, not Neha. Prabhati, is that clear?
Yes, ma'am. Madam, do we have to take a written consent from the patient that somebody will be present during the examination or the POPQ exam?
That is the whole idea of giving you this question. It's verbal consent.
Okay, ma'am.
Otherwise, you will end up taking for all you. It's like a same medical system here, right? How many juniors assist you in medical college? Right?
Yeah.
Okay. Neha, the difference between 4 years is what they say is, if, for example, if the patient or a youngster, whoever has come to you, she's 14 years and the boyfriend is 20 years. Let's assume that. Doesn't mean that it will be sexual abuse all the time. You are cautious that once it is more than 4 years, you are cautious to look if there is any element of grooming. Okay? Is that clear?
In question 11, this Down syndrome patient can give consent?
How can they give consent, my dear? It is a low IQ, right?
Then,
they will have a low IQ, right?
I couldn't understand the answer.
Can you read the answer?
Obtain legal advice on interpretation on Mental Capacity Act 2005.
So you have to obtain the legal advice. on their IQ. So there is a mental capacity advocate, and mental capacity is completely decided by Mental Capacity Act 2005. So you're going to obtain a legal advice on how to go about for this particular patient. Clear? Is
Okay,
that
then
clear?
how to decide on whose consent we can take?
Sweetheart, that is what? That is, you are an ST2 or ST3 for this exam. Okay. So what you do is you leave a the legal advice. The advocate would discuss with the legal team who would be able to give the consent. Okay. Somebody with the parent, it depends upon the mental capacity. If they do not have, then whoever has the parental responsibility, they are the one who are going to give in case of elective. But basically here it is, if nobody is there for them, then the court of law can give them an order to proceed. Okay. Okay. And Neha, it is to rule out sexual grooming, dear. Whenever there is a lot of age difference, probably they have been given expensive gifts to have sex, right? So that is the thing you want to rule out. Doesn't mean that if somebody is more than 4 years, they will be sexually abused, right? But you have to understand what is the scenario and then take it from there. Hope that's clear, Neha. For a girl who is 15 wants termination, of course you can do both. What is the problem there? They have to have a capacity. And written consent when the medical students, no. Anybody for examination, it is always a verbal consent. It is not written consent. Guys, understand the amount of work you're going to put. They are also going to see a lot of patients, right? For everything, you won't be taking a written consent. Okay. But you are going to explain that my junior is going to examine and so on. Okay. Let's move on. Beneficence. See, beneficence is you are going to take that is a principle of ethics, my dear. Beneficence, autonomy, non-malfeasance, justice, they are all the principles of ethics. So that is what the application is all about. Beneficence is you will be doing in the best interest of the patient. So we are talking about the same things. Okay. Okay, till 18, patient cannot refuse but can consent. Yes, correct. The thing is, till 18, they cannot refuse any treatment, but they can accept any treatment if they are okay. Is this clear? Are we good so far? Please go back and read this clinical governance, because 100% there will be a lot of questions on this. Okay, because this is their system. You are supposed to be understanding the basic rule of this. Who should be taking parental consent, my dear? Yes. If at all, if you say that they cannot, if they are refusing, you have to take the consent of the parents. Okay. If the parents both are, for example,